Hi, myself Ron, and let's know about menstrual cycle. Menstrual cycle occurs in females in primates, mainly in apes and humans. It's a reproductive cycle in which there is a release of ovum at the particular interval, along with there is a fertile period and infertile period. And estrous cycles occurs in lower animals, including cows, dogs, and rest of animals. But primates are restricted to menstrual cycle, which occurs in females of humans in 28 days, and another apes like chimpanzee of 15 days. And menstrual cycle, there is a organ that is uterus, which is a reproductive organ which is related to menstrual, and there is a primary sex organ, female is ovary, and there is are not too much reproductive, but there is a few parts like fallopian tube, and there is a uterus cavity in which the embryo resides. First is fertilization. In fertilization, the sperm from the male partner comes through the vagina to the process called as capacitation. Then after, in fallopian tube, the fertilization happens because ovum is collected by the fimbriae, that is hair-like projection from the ovary. In menstrual cycle, in females, there is 28 days. First 4 days are menstrual, then that is loss of blood. Loss of blood is nothing but the shedding endometrium due to failure of pregnancy. And at the 14th day, that is ovulation occurs, and then after there is secretory phase in uterus, that is increasing uterus lining, increasing mucus glands and blood supply, because it is similar to cushion, and that is uh, uterus is ready for the implantation of the baby. That's not baby, it's a zygote. Then formation of embryo. If menstrual cycle fulfills, means its pregnancy happens, then menstrual cycle is ceased for rest 9 months, and then after there is a 6 months of lactation and amenorrhea. Then after, in menstrual cycle, there is loss of blood from the spiral arteries, as it is a basic, like there is a uterine artery branch from the common leg branch from the abdominal artery. Uterine artery leads to the branches from the uterine artery, that is spiral artery branches from the radial, and radial from the arcuate. Spiral artery supplies the endothelium of the uterus, and there is a spongy uterus. It's similar to the very good environment for the implantation of embryo, and supplies the nutrients through the blood, along with the gland secretion known as a milk of uterus. Then after, in menstrual cycle, there is a fibrinolysis, which is an anticoagulant, and that's why there is no clot formation during the menstruation, just a passing of blood. It occurs in ideally in 28 days, of 4 days of menstrual, and then after 14 day ovulation, then rest days for the implantation. If implantation not occur, then menstrual cycle begins againly, and there is a pregnancy, then menstrual cease, and uterus change to dysphoria. Then after, in menstrual problems, mostly the infections, along with anemia. In India, around 69% females are anemic, and in reproductive age, that from 15 to 45, the reproductive age, loss of blood from the menstrual, main cause of iron deficiency anemia. And iron deficiency anemia is one of the most dangerous cause of the of maternal mortality, because loss of iron causes the loss of the concentrations and all those things, like a loss of blood, which leads to the female goes in shock after delivery or within delivery. And there is a national program, that is Anemia Mukta Bharat, because of the decreasing maternal mortality, and along with improve the adolescent health. And there's a tablets for this, includes the 20 milligram, 40 milligram, 60 milligram iron in various forms. After delivery or before delivery 180 days, and after 180 days, the supplementation of iron along with folic acid, which influence the female, improve the health, along with betterment of the fetus. And in females, there is menstrual cycle, and which can control like hysterectomy after the age or any sort of fibroids or anything. And it's not similarly, it's not similar to hysterectomy cycle because females are capable only fertile for 7 to 4 days. Yes, 4 to 7 days, just before 4 days and after 3 days. And menstrual cycle sees in females around 15 years, that known as a menopause, and at begin its menarche in 10 to 14 years, 14 years. And the phase from the menarche to menopause is a reproductive age in which every month they sheds the ovules, and if pregnancy not happen, then menstruation occur. And menstrual, there's a myth about menstruation because it's there is known as a there's a taboo that they don't believe that it's good for health, and there's a social stigma for the menstrual. But it's a reproductive cycle. There is no any connection with any sort of demon or any sort of unholy space create around her. Just pain, and the way they are treating females is good different, because menstrual cycle is nothing but it's a part of female life, and it occurs in who who bears the uterus, and it is not occur in the transgenders or all those change their gender by operation or anything. And menstruation is important because it's a reproductive cycle, and it's a childbearing process. I share your opinion about menstrual cycle, and try to aware yourself and your surrounding about menstrual hygiene and menstrual care, because it's just a reproductive cycle. No any taboo, any stigma around, so-called stigma, because it's scientific way the cycle begins and ends or anything. Use any type of hygiene, and don't overrate any type of procedure or any process that female follows. Just simply go, and hygiene is important. And I think I recommended a movie of the celebrity name is Akshay Kumar, that is Batman. You must watch it. Yes, thank you.